Rebecca, it's good to see you. Thanks for making time. Let's just start and tell us what these new changes, or what this new rule, I should say, from Centers for Medicare and Medicaid Services will exactly mean.
It means that there's going to be barriers between people and being able to access their health insurance that they get through Medicaid. That's what it actually means. These changes really impact people that are getting Medicaid through the Medicaid expansion program. So it's 19 to 64. In North Carolina, you have to be a resident of North Carolina and fit into a certain income eligibility, which is about 138% federal poverty or below for a single person. We just basically expanded Medicaid a couple years ago, December 1st, 2023. And since that time, 720,000 plus North Carolinians have been able to get health coverage through this life-saving, life-changing program. And now, unfortunately, because of these changes, we're going to be putting paperwork barriers between people and the care. I just want to point out that the guidelines that came out, okay, to help people navigate this was 380 pages long. Okay, why are we putting these types of barriers between people and being able to get health insurance coverage?
You get to a point that I want to touch on here, because the argument from the administration is that the goal of this is to get people working. The Medicaid recipients that you come across are people who are trying to get Medicaid. Is this a matter of they cannot work, they do not want to work, or is there another barrier here?
No, first off, I think the majority of people actually are working. The other people have legitimate reasons, many of them not to work. They're caretaking for their young children or a loved one who is disabled or elderly. They could be living in an area which has high unemployment, right? Rates. The unemployment is not really available, employment is not really available to them, things like that. Or because maybe they haven't reached the level of disability that they could apply for disability benefits, but they have a very serious condition that keeps them from working those types of hours.
So, Rebecca, one of the other aspects of this sweeping tax and spending legislation that the president signed last summer is with what it will mean for healthcare in rural communities. The bill includes, or it included, a federal rural hospital fund, $50 billion that will go to rural hospitals. The concern with that is that it is far from enough from what the Medicaid cuts will result in for those hospitals. We asked Dr. Mehmet Oz about the situation with rural hospitals. I want to play with you what he said and get your reaction afterwards.
One of the big opportunities is to get urban America and rural America together again. So if you're a small practice in a rural part of North Carolina and you deliver 2 babies a week, and you got to make a mecca in Charlotte or one of the big major cities that's got 50 babies a day coming out, why don't you adopt that smaller center? Allow it to get up to date on the most newest techniques, the best ideas, make it part of the same family.
So I think the argument here is, what he's saying is, let's get bigger communities with hospitals, with large hospitals to come in and help out these small rural community hospitals. We have seen about a dozen, according to the state, rural hospitals closed since 2006 in North Carolina. I mean, is that a feasible scenario that you see happening?
Well, there's a couple different things that he's talking about in that clip. I would say first and foremost that because we're putting barriers between people and enrolling in health insurance, this is going to lead to more uninsured people. Disproportionately, that's going to impact people in our rural areas, because there are more people that rely on Medicaid because there's more poverty, unfortunately, and that is what happens. So the more uninsured people in those areas, the more these hospitals are going to go back to having that uncompensated care piece, and they're already on these razor-thin margins, and that's going to be difficult. So what could happen is you can have consolidation where you have these bigger hospital systems come in, but oftentimes that raises the cost for everyone. They sometimes gut those hospitals or take out things like labor and delivery or emergency rooms. So it's not the same level of care that they're used to. He also did talk about the Rural Health Transformation Fund, which, by the way, I think is one of the only good things that was in what I call the big bad bill. And The problem with it is it's a 5-year program. There's no guarantee of money past that first year, and it's very time sensitive. Now, North Carolina has come up with a really good plan, but I just don't know if the timetable that states have been given to deal with this is actually going to set states up for success. And by the way, I feel the same way about the work reporting requirements. The guidance just came out on June 1st, and these are big sweeping changes that states are going to have to make to the bureaucratic side of benefits, and they have to do this all by January 1st.
Rebecca Cerese from the North Carolina Justice Center, appreciate your time. There's a lot more to come on this. Thanks so much.
Thank you.